WCRF exists to improve the cure rates of women with gynecologic cancers. We've been at this for over 30 years. We'll be at this for as long as it takes. You need a research organization like WCRF in order to find the new cures and get them out so that patients can be treated with them. I started Gynecologic Oncology Associates in 1985 as a solo practice in Newport Beach, California. It's grown to be the largest, busiest gynecologic oncology group on the West Coast. Gynecologic Oncology Associates and Women's Cancer Research Foundation work together in order to treat women with ovarian, uterine, cervical, and other women's cancers with the latest experimental treatments, both medications, robotic surgical options, and other new modalities to improve cure rates. Clinical research is looking at new medications primarily, but also other treatment options to determine if they can increase the cure rates of women with ovarian and other gynecologic cancers. It is a complicated process to take a new medication. You don't know if it works. Quite often you don't even know what the side effects are. You need an excellent group of gynecologic oncologists in order to take these new unknown medications, treat the patients with them, deal with any side effects that might occur, and then an excellent data management team, which is what Women's Cancer Research Foundation does, in order to determine if the medications actually have worked, if they have improved cure rates. The Women's Cancer Research Foundation has a PhD, Dr. Bram Goldstein, who helps us write new protocols so that if a doctor, for example, had an idea about using a new medication in a certain way, the doctor would sit down with Dr. Goldstein and the rest of our Women's Cancer Research Foundation team. They would design a study to determine if that new medication could work and write a protocol, create data management forms, create statistical analysis forms, actually have the research team do the study itself, collect all the data, collate the data, analyze the data statistically, and with Dr. Goldstein, the gynecologic oncologist will write a final paper that will then be published in a peer-reviewed journal. Almost all women with ovarian cancer, newly diagnosed ovarian cancer, already have widespread disease. The cure rates in that situation are only about 35%. So when you're dealing with a disease that has a 35% cure rate, I know all of our physicians and researchers feel morally obligated to try to improve that number, to try to come up with new treatments. So that is why the research and the clinical side are so closely linked. If we had a 100% cure rate, it'd be a different ballgame. But with a 35% cure rate, every day you're looking for what can I do better? How can I get that cure rate above 35%? Gynecologic Oncology Associates does have higher cure rates than the national average. And I think part of that clearly is that they're amazing doctors, amazing surgeons, but also they're always looking for the new options, the better ways to treat patients, and that in turn gets reflected in higher cure rates. The older model said basically you had to be a doctor to do this stuff, and it's just not true. I mean, a lot of research is best done by other people. A lot of it is more like accounting work and legal work and contracting work and statistical work. I mean, all those things you do not need a doctor for. In fact, other specialized research teams will do a better job. Every time WCRF gets a donation, 90% of that money goes to our research team. We do have about 90 people in the practice and other parts of our organization that work for free to support research. So that's one of the ways we're able to keep our overhead down to just 10%. The end goal for WCRF is to be put out of business because all women with gynecologic cancers are cured. So that at that point you would not need more research. We would be finished and we could go on back to the beach.